Well, as I say, PricewaterhouseCoopers has estimated that defensive medicine costs at $210 billion a year. And you know, the Obama bill is about, he said $950 billion over 10 years. So defensive medicine is a lot of money. And the Congressional Budget Office has said that if medical malpractice reform was done, they could reduce the deficit by $54 billion a year. So there's a lot of money that. Right. So
10%.
I can't work that out of my head right now. But
It's 10%.
yeah. So, but it's a lot. It's a lot.
Our national expenditures in healthcare is about 2.6 trillion.
2.5 trillion was a new number. 17.3% of gross domestic product.
So 200. The thing is, though, it's a state's issue, though, you mentioned.
Right.
So I would be concerned if they did it on a national scale.
Oh, I don't want a national standard. I just want them to acknowledge and encourage states, if they want to reduce costs, they should do med-mal. And you can use the Texas example, you can use the California example, and Haley Barbour in Mississippi, they've done med-mal reform too. Yes?
Whether you have a government provided insurance plan or a private insurance plan, there's always a third-party payer, so there's kind of a moral hazard problem that insulates the consumer from price sensitivity to an individual procedure. So is there a case to be made that we're kind of overinsured, and is there a solution to that?
Right. So, yeah, we have, as I said, a third-party payer system. Either the payer is an insurance company or it is the government. And I think that I'd love to, that's why I support patient-centered solutions, why, you know, putting patients in charge through health savings accounts. So we have about 9 million Americans today who have HSAs with that high deductible insurance plan. And people, McKinsey has shown that people with HSAs are 35% more likely to have an annual physical because, of course, they are concerned about, you know, waiting and then finding they have something serious which costs a lot more money. And so I think putting people in charge is a good way, but people overuse healthcare because there's no transparency. They don't know, you know, what something costs. One of the chaps that works with me called up, he needed a hernia repair, and so he called up Cal Pacific and said, how much is a hernia repair? And they said, oh, well, we don't know. We actually don't know. And he said, well, if I wanted to pay for it myself, how much would it cost? Well, we don't know. So then they called back and said, well, we think it would cost about $4,000. And they said, but if you have insurance, the cost is about $16,000. So anyway, so he went and he paid for it himself. But you know, because the big insurers negotiate with the docs, they negotiate with the hospitals, and they get, you know, rates, and so depending on they get the discount rates. But so people have no idea what something costs. When you know what your phone service costs or what your credit card, American people are smart. They make conscious decisions about what they want to pay. And so, but in healthcare, it's not transparent. And I don't want government, you know, saying, you know, what insurance companies can plan or not. But if we can open up the market, I think, and we have more competition even within the insurance industry, and if we were to voucherize people on Medicare, you know, not everyone would you know, want to have a voucher for Medicare, but then they could decide what HMO plan they want to be on or what PPO plan. But you know, the president has said he doesn't like Medicare Advantage, which is the private arm of Medicare. We have about 40 million Americans who have Medicare Advantage through an HMO, very, very popular, and he says it's too expensive for what the government pays, so you know, he wants to get rid of Medicare Advantage, except, of course, in addition to the Cornhusker kickback in Nebraska on the Medicaid and the Louisiana purchase on the funds for Louisiana for Katrina, and then there, of course, was the Florida kickback where they would not be, people would not lose their Medicare Advantage plan. So, you know, it's amazing what politics can do in sleazy deals. Yes?
Two things. Here in Nevada, by the way, it's about 62% of our medical is covered by the federal government through one of the plans.
Right. Is that because your population is older?
I think so, older as well as the Veterans Administration.
Right,
so,
right.
Number two, I hear a lot of the candidates talk about something you said. I'd love to be able to buy my health insurance across the state line, so I could buy a Mississippi plan that costs $125 a month for a 58-year-old person, and all that's really well and good, except, unfortunately, here in the state of Nevada, the voters of this state, through our legislature, have enacted 54 mandates. And so that policy out of Mississippi doesn't cover any of the mandates here. And when I get sick here and I want to go and have my just a kid taken care of or whatever else happens, and it doesn't cover it, me, the citizen of Nevada, goes to the insurance commissioner and complains. He says, where do you want to sue? You want to sue in Nevada or Mississippi? Because I really don't have any choice. I can't make them fall under Nevada law. So I think buying across state lines, as much as it may appear to be good,
Right.
the reality is, even with car insurance, you may buy it out of Texas, but it still has to comply with Nevada law.
Right, and that's why I'm a huge proponent of reducing the number of individual mandates. Because if we can get rid of those mandates, and if you want to buy a plan, if some plan, some company will offer a plan that covers in vitro fertilization and hair prostheses and things, and you can buy that one. But if you want a stripped down plan, you can do that as well. But the mandate problem is huge.
We actually tried that here in Nevada 4 or 5 years ago. One of the major companies here put out a plan just like that. Nobody bought it. Nobody wanted it. It didn't cover anything that they wanted.
Right. Well, and of course, the lobbying arms for these plans is very, very, very strong. Whether it's the chiropractors, they're all in Washington all the time lobbying for getting their particular industry covered. Yes.
Besides getting the mandates repealed, one of the things that could actually work with purchasing insurance through other states is the reciprocity. Like I'm a concealed firearms carrier, and I carry 3 concealed weapons permits here, Utah, Arizona. And what they do with the mandates and the laws, and we can apply it in an insurance company, is go with other states that actually have the same mandates. You understand? Just as
Yes.
whatever is more stringent, with the same as gun laws
So that
and health laws.
it covers, yes.
Yes.
No, that is a good
So-
idea. The other thing is about the mandate. Today the president said, the Congressional Budget Offices said that premiums will not rise under my plan. And during the campaign, of course, he said that with his type of plan, people would have a reduction in the cost of their health insurance by individuals by $2,500 a year. And he said, the CBO has scored my plan and people will be paying less for their insurance, even with the mandates. Well, Eric Cantor got the CBO letter out, which we all had copies of, where the CBO said that, premiums would increase $2,100 per year, not go down by $2,500. So, it's a lot of talk going on.
Right.
Yes.
One of the biggest currents that's running through all of reform is the financing of reform. And it seems that it's always being financed on the backs of responsible citizens. There was a call to get something like the soda tax.
Right?
All right, which wouldn't have been that much money individually, but it was put down because they said it was disproportionately affecting the poor. My question is, aren't the poor using the care, the uncompensated care, disproportionately then over everyone else? And do you see anything in the current legislation or environment that would go back to looking at, say, soda taxes and things of that nature?
Well, just before I answer that, in Massachusetts, because Deval Patrick found that, the healthcare costs were going up at a much greater rate than they had ever anticipated in their budget projections. 23% of people in Massachusetts were still turning up at the emergency room for care. And so they introduced a $1 per pack cigarette tax, saying, well, we'll be able to cover our shortfall with this. But what they didn't realize is that when prices go up, people make conscious decisions about what they're going to do. So the revenue actually fell from that tax. The point you're talking about is what we call the hidden tax. And Obama just in his plan said that the uninsured add $1,000 per year to the cost of premium of those people who have insurance.